So today I'm going to be treating the Achilles tendon using the Enraf Nonius Tecarpuls. I'll select ankle, and it's the first protocol, Achilles tendon. As you can see, it's pre-selected level 9 in 5 minutes. I'm using the small treatment head, and I like to do 1 minute per treatment head size, so I'm actually going to come up to 6 minutes here. In a larger Achilles tendon, you may need to go to even more minutes. Of course, there's always that balance between minutes, doing too many, and spreading the heat out too much. I've put the patient's foot over, ankle over a paper roll, and we'll just get the thermal image here. As you can see, up towards the mid-substance of the Achilles it's warmer, and down towards the insertion it's cooler, averaging about 26-27 degrees, which would be about normal for a soft tissue, and maybe a little bit low in this area. I've put the ankle over a paper roll to take the Achilles tendon off tension and to stop the patient from being in maximal plantar flexion, which would actually shorten the Achilles tendon, pushing it together. You can do this by just putting the patient's foot off the end of the bed. I'll apply some contact medium to the earthing electrode, and I'm going to put the earthing electrode underneath the patient's thigh rather than the tibia. I don't like putting the earthing electrode under bony parts. I'll apply some contact medium here to the Achilles, and I'm going to apply that contact medium generously. That's because it will become absorbed during the treatment, and once it starts to get absorbed, it will start to go sticky, and I don't want that. It stops you moving the treatment head as easily. Small treatment head here, not the large treatment head. You don't want the large treatment head when you get down near the insertion of the Achilles tendon. And here we go. Switch the machine on and start moving it round in fairly rapid circles, coming across the Achilles tendon. This is a really popular treatment for chronic Achilles tendon problems. So people debate why patients have Achilles tendon pain and why patients have Achilles tendon problems, and debate rages over whether or not the infiltration of blood vessels and of course nerves into the Achilles tendon is responsible for the swelling that you often see, or in fact if that is just a response to try and heal the Achilles tendon. It doesn't matter whether you want to call that eosinophilization or neovascularization. Neovascularization is a misused term often. It really should be used in children, but it's often used in adult tendons as well. Whether or not you believe that increased circulation is a good or a bad thing, whether or not you believe that you get problems within the tendon, within the sheath of the tendon, scar tissue within the tendon, changes to the matrix of the tendon leading to degeneration of the fibres. From the patient's perspective, it really doesn't matter. They've got pain in their Achilles tendon. Tends to be worse when they do activities that put the foot into dorsiflexion, and so the Tecarpuls is very good at increasing the temperature in the area, increasing the circulation to the area, and increasing the elasticity to the area. So depending on which side of the debate you sit, if a patient is having trouble with dorsiflexion, and they usually say things like, it hurts when I go upstairs, it hurts when I go up hills, I can't get my heel to the floor in the morning when I get out of bed, the Tecarpuls would increase that elasticity and allow the foot to go into those dorsiflex positions more easily. Very, very good in acute, chronic problems, not acute problems. I've cut to the end of the treatment here just because it's a very long treatment, and as you can see, the heat has built up really well in the Achilles. We're up into the 30 degrees, even down near the insertion, and if you're looking at the maximum here, you'll see we get into the 33 degrees where the energy is being absorbed the best. A good treatment in chronic conditions, as long as you're looking to increase that elasticity and increase the circulation to the area.